Congratulations on getting married, and hope the wedded bliss is all that you thought it would be. So, as Sadie mentioned, my name is Andy Larson. I'm going to go ahead and turn my my camera off here just so we can focus on the content at hand. And today we're here to talk about our new senior indemnity product. We're pretty excited about as well. It's our newest addition to our portfolio. And as we go through our housekeeping, just some introductions again. I cover all broker sales for the upper Midwest for under and over 65 sales with National General. I'm based out of Minneapolis. Don't come here today. It's like -15 air temperature. So I would recommend staying out of the vicinity of Minnesota. But also on our team is specializing in supporting brokers in the field for senior products is Chris Neek. He's based out of Kansas City, but from what I understand, it's -5 degrees there as well. So anywhere you go in the Midwest, it's going to be cold today, but we got some hot products to talk about. So as we get into this, when we talk to brokers in the field and we find out about the interactions with their clients, it's a common occurrence that comes up and you don't really think about it until the conversation is brought up is, have you ever had a client that maybe missed their Medicare window, they're locked out of coverage? And a lot of times we hear from agents that, I just had somebody last week that had this scenario. I didn't really know what to do with them. And it may look a little something like this. So we're going to look at a guy like Steve, perhaps. Steve maybe turned 65 last year. He enrolled in Social Security right away, but that automatically enrolled him in Part A. He retired in June 1st, but the problem here is that he didn't enroll in Part B on time. He already has Part A coverage, so he's not eligible for ACA. Now, right now we're in the general enrollment period, so he can sign up for the Part B, but that Part B doesn't start until July 1st. So Steve's got a little bit of a gap here without the Part B coverage, can't get on a Medigap, maybe missed other enrollment periods. So the solution we're going to talk about here today is the National General Senior Indemnity, and we have a couple of different options to choose from, but we're going to focus on the Max plan. So we're going to give you an overview of this and how this scenario can fit into your clients who you may run into. And as we think about it and look at those scenarios, you say, yeah, I ran into somebody like that last week or what have you. They say that almost 1 million people a year miss their Medicare window. It's a staggering number. So there's opportunity with this type of product. So our goal here is to talk about the product itself, who it's for, give a couple different case studies where this might fit in and some other niches, and then how you can quote and enroll this with simplicity and ease. And then as Sadie mentioned at the end, we'll do any questions and answers. So quick overview of the product. The numbers speak for themselves. I think if we've been on a webinar or two, we know the challenges of healthcare and the money that's spent that goes up and up and up every year, the bankruptcy statistics as it pertains to seniors especially, the increase of bankruptcies fueled largely by healthcare costs. And as I mentioned, approximately 1 million people a year miss their enrollment window. So what does the senior indemnity do to help solve for those problems? Well, it provides a predictable benefit to help pay for healthcare expenses up to a certain expense. So there's a fixed benefit, meaning that it's going to pay a set dollar amount for certain covered healthcare services. It'll pay the same benefit regardless of amount the provider charges. And then above and beyond, the client is responsible for any excess. But at the end of the day, it helps your client offset medical expenses that may be their responsibility up to a certain dollar. So what does it cover? Well, first and foremost, there's an immediate benefit for sickness, 90-day benefit or 90-day waiting period for preventive care, but covers not only what you might find on, say, like a traditional hospital indemnity, but it also covers outpatient services such as office visits and urgent care, lab services, surgical benefits, and then hospitalizations up to 31 days per plan year. It is guaranteed renewable, so therefore there's for as long as your client needs it, it is guaranteed renewable. As Sadie mentioned, this is a newer product for us. We launched it predominantly in the South and Southeast here late in 2021. And we've actually had this product online in Missouri since approximately late November. But with the throes of enrollment, the timing to bring this to market was just not right. So here we are today. And so who is it for? And you look at your target client, you look at it from starting off with eligibility. Primary applicants are ages 65 through 74 at the time of application, and that also includes a spouse. So you can do primary and spouse on the same application. And if there are dependent children, they can still be on this plan just as long as they're under age 26. It is renewable to age 85. It does require a health questionnaire, and we'll show you that here in a little bit. But since it is age 65 to 74, there are no child-only applications. Now, the good news is, though, is that we do have a similar product if the need is there on the under 65 that could apply in that case. So target clients by plan type, and what we mean by this is that we have two different options to consider when you look at senior indemnity with NatGen. First is going to be the base plan, and then we talk about the max plan. So the base plan is going to be similar to your traditional hospital indemnity type plan, which would be a great option for those who maybe are looking to supplement their Med Advantage or their Med Sub plan. Maybe you already utilize those type of plans today. But where we want to focus today is on the max plan, because the max plans are going to offer a richer benefit above and beyond just the hospital, but it's also going to include some of those additional benefits to where your client will have the surgical, outpatient, lab and X-ray, etc. So as we cast our gaze on the max plans, just here's a snapshot. I'm not going to go through this line by line, but as you'll see here on the far right, the base plans are going to be somewhat in line with your traditional hospital expense. But on the max plans, we go up to $5,000 per admission, 2 admissions per year, and then up to $1,000 per day for confinement for sickness and injury up to 31 days. So that the 5,000 is going to be pretty strong, and as well as the confinement on that plan 3. And then based upon a pricing difference your client wants, they can reduce that benefit down to $2,000 or $1,000 on admission, and accordingly on the confinement as well. But now here come the extras. So like surgical benefit, $5,000 across the board for 5 surgeries per year for a tier 1, and a tier 2 surgery across the board here, 1,000 on plan 1, but increases up to 2,500. Now there's also transitional care, so skilled nursing facility is going to be included in this automatically up to 60 days, $250 a day. Outpatient services. So now we're getting into more of the day-to-day. So if someone who doesn't or needs to have something paid for, maybe an office visit, this is going to cover up to $75 for 2 office visits and $100 for the preventive visit, again, after a 90-day waiting period. Urgent care is going to have benefits as well, and this is also going to apply on the base plan. So added benefit if you're looking for that supplemental to the Med Advantage or to the Med Sub. Radiology and laboratory. So you look at the lab benefits, pretty standard across the board, $50 per test, 2 tests per year for radiology and lab. And again, these are set benefits that we pay to the client, or to assign benefits to the provider to the client. Now, when you look at the charges that are made, now this maybe put a little bit of freedom on the side of the client to maybe research who that doctor is going to be, to say, well, Dr. X charges $100 for an X-ray, well, Dr. Z charges $150 for an X-ray, and they can maybe make that determine who they're going to see based on that. So a little bit of flexibility in terms of some more consumer awareness. But at the end of the day, these are not network tied plans, so no matter what the charges are, the benefit is going to pay out according. And lastly, emergency benefits. So on the max plans, you're going to find that there's going to be ambulatory benefit up to 2 trips for ground, and then $5,000 per trip for ambulance. So if you have a client that's in a rural area, that can help offset some of the costs that is applied toward air ambulance. Now again, if this is an indemnity plan, so if your client has other coverage, this will pay on top of other coverage as well to help offset those expenses that are incurred due to the services that are listed on these grids. We do have a YouTube channel that does kind of go into detail a little bit further more down to that granular level that can give you some more, provide more detail on the actual benefits, dive deeper into the plan itself. Chris can help you navigate those waters as well if you want to do one-on-one training on these products. But today we're just creating the awareness and who is this for? And as we talked about, Steve, for example, here we talked about him right away at the beginning. We solved his problem because he was a late enrollee, didn't just enroll on time for Part B, so he's got to wait it out till July of this year. But if we put him on that, let's just say a Plan 2 max plan at a premium of $132.95 per month, that'll help him provide a Plan 2 benefits until he can get onto Plan B, and he can continue on this plan as a supplement to that if so, or if his final destination is Medicare Advantage, can remain on this as well to offset the expenses that are incurred toward him on that Med Advantage plan. And for you, the agent, it does come with some commission. It does. We kind of all like commission at the various stages of the process. So when you look at the commission on this one, approximately for this plan, it's going to be about $50 a month as earned. So that's the first year. Then there's a renewal commission that reduces for years 2 and on. So another case study here to take a look at, and we're going to talk about Martha. Maybe Martha was a homemaker or something like that. She only worked 4 years up until age 65. Maybe didn't have, her spouse didn't have the group plan or or maybe perhaps she is a widow and the deceased benefits maybe weren't enough to qualify for a Part B. She didn't have enough credits. Maybe won't run into this one as much as others, but just one to keep in mind as well. But if she doesn't have enough credits, she will possibly be responsible for the Part B premium. And if that Part B premium is cost prohibitive, you can look at a max plan with NatGen. The Plan 3 premium, just as an example's sake, $198 per month. It's going to again cover that $5,000 for admission and $1,000 per day for the accident or injury confinement, and provide all the extra benefits that come along with it, from the surgical to the outpatient, doctor visits, emergency. And as you look at that premium and what your income could be on that, another solution here, another reason why we might look at this product. Now, this one again is probably going to be less common in terms of the ones you run into. But let's take a look at Sven and Lena. I'm from the Midwest and I have Scandinavian roots, so we're going to use Scandinavian type of scenarios here. And Sven and Lena, they just immigrated to the United States. They've only been here for 3 years. They just moved from Sweden, but they haven't been residents for 5 years to qualify. So from that standpoint, ACA could be an option for them still, but it could be cost prohibitive. So the solution, if you were to look at, say, the max plan, level 3, for both Sven and Lena, combined, because you can put them on the same application because they're both over 65, $396.26 per month, and then that earns you approximately $170 per month as earned for that first year. So as you see here, this might be more of that secondary reason why this product might be as a niche for someone who might have missed that window. We go back to the original question. Hey, have you had anybody that maybe missed their Medicare window, or they were locked out of coverage for whatever reason? This is where the max plan comes in and can be a great addition to your portfolio. So that way you don't have to turn away clients, which is the common theme from agents that we've talked to that have had that scenario. They just didn't have anything for them. So as we look forward to this more, and as we get into the how-to and whatnot, just be advised we will be sending out additional training materials such as sound bites. There will be brochures, and also we'll send Sadie a flyer as well that can help you with your marketing efforts also. So next question is, all right, well, Andy, this is exciting. This is a great addition, I think, and I think I know where I can make this product fit in. How do I quote this? How do I enroll my client? The Senior Indemnity product is all online enrollment through your enrollnatgen.com portal that you automatically get and when you get contracted with National General. So the process looks like this. You're going to enter in your demographics just like you would as a Medicare supplement quote. It's the same platform. If you've been writing on EnrollNatGen for MedSup, you'll know it's the same. But when you enter in your demographics, it'll show what plans are available for that client. And you're going to find Senior Indemnity. So what you'll do when you find Senior Indemnity, you'll hit the expand button. And then what that will do is we'll expand all the different plans that are available for you. So now you're at the section where you're choosing the plan. And you can see here, this is just, this is based upon a 67-year-old in 63021 zip code. The difference in cost from the plan 1 to plan 3 on the max side, but then also the differences on the base plans, again, which are more in line with your traditional hospital indemnity. If you need to access materials, you can click on the Senior Indemnity brochure. That'll bring everything up and give you all the ins and outs and all the exclusions and limitations. But then once you've selected the plan, you simply click the Add button, and that will bring that plan chosen into the shopping cart. So now you'll see at the side of your screen on the right side your cart, but we'll also remind you that, hey, just don't forget that National General offers dental vision hearing. Did you add the dental vision hearing? If you add that to this product, your dental premium for your client is going to be 10% less with that bundling discount. So just a reminder there. But once you've selected the final plan design, you'll see your cart, then you click the apply button. Now, once you go to apply, here comes the underwriting. There's 3 underwriting questions, and it's simplified underwriting, yes or no, accept or decline right on the spot. So the 3 different questions are going to be in the last 5 years. Has anyone received any surgical treatment for those surgical treatment consulted or been prescribed? So the product itself does not cover for pre-existing conditions. There is a 12-month look-back period, but at the end of the day, for those where this is a fit, they're the ones that can answer no to all of these questions. The second question is last 5 years been consulted with HIV/AIDS, and then the third one, last 12 months been scheduled for any scheduled or recommended treatment, any surgeries that have been scheduled not completed, or awaiting any test results. So just typical adverse selection type questions that you might find. Very simplified though. And also there'll be an expected parent questionnaire, which you'll find in that box as well. But once that's done, then it just goes through the regular enrollment process. Who are you? Where do you live? How do we get a hold of you? And then billing. So billing is done by EFT at this time. I believe we're working on getting a credit card also added to the portfolio or to the mix of payment options for your client. And then signature options are going to be similar to what you have with Medicare Supplement. You have e-signature, voice, and then also passphrase that includes take on mother's maiden name. So that's the application process, and we can go further down the line, or you can do a dummy quote within your EnrollNatGen platform to understand. Then once your client's policy is in force, they can go to their mynatgen.com, which all your clients that enroll in a NatGen product have access to. And they can view their policy documents, print ID cards, and check their payment, current and past payments, as well as their payment method. So from that standpoint, that's the product, that's the how-to. The next step is a couple of reminders here. Wanted to remind you that we do have a MedSup bonus that's going on right now for birthday or anniversary rule in Missouri. If you sell 3 policies per month, it's $150 extra per policy after you sell 3, and there's no limit above that. Each month is its own month. We sent this out earlier this month, and on the flyer it was said to be till February of 28, so 2 months, but we've actually extended it through the month of March. So each month will have its own chance to qualify. 3 policies per month gets you in the door, $150 per policy back to policy 1. And then if you do add a DVH plan to the MedSup plan, you do a bundled sale through EnrollNatGen, that's going to get you an extra $50 on top of that $150. So that's a pretty nice chunk of change that's available for you as a bonus here for Q1. don't let this one expire without taking advantage. And lastly, again, reminder that the DVH, if you have questions on that, the basics on this are the highlights. There's no waiting period on basic and major services. We have implant and denture coverage on our levels 2 and 3 plan, network access through Aetna dental administrators, hearing benefit included, and that's through Amplifon, and vision plan is available as well as a rider. The rider is networked through Avisis, which is super strong on the retail side of things when it comes to network access. But if you are not involved with National General and you're looking for ways to get involved with the Senior Indemnity, or if you want to take a look at our MedSup or DVH, the next step would be for you to get contracted. If you're already contracted, you already have access to this, so you just need to know where to go, and so Chris can help you out with that. But if you haven't gotten contracted, get with your sales team at SMS. They'll send you a contracting link. Once you fill that out, it's a 24-hour turnaround time for you to become active with National General. There are a couple states that require pre-appointment, such as Oklahoma and Kansas, short circuit or close circuit to Missouri. So that might take a couple extra days to get that part online. But once you do get your welcome letter, that will allow you to set up your tools. So you can get with Chris, or Chris will reach out to you to make sure that you are set up and you feel comfortable with the quoting tools. And then you can start writing that gen. And with your contract, that not only gets you access to our senior portfolio products, but also our under 65 portfolio as well, short-term medical, supplemental accident, critical illness, hospital, and then our dental suite, indemnity, term life, you name it. So you'll have a broad selection of products with National General to choose from, and our team is here to support you no matter side of the 65 coin. As I mentioned, we do have a YouTube video that can talk about the senior indemnity that goes specific, more in depth, more of the nuts and bolts. We went high level, more conceptual here today. But also you can access brochures at natgenhealth.com under the agents and brokers tab. And there'll be not only brochures, but there'll be marketing materials. If you are selling MedSup and you do paper apps are available there as well, and as well as claim forms. So that's the nuts and bolts of the senior indemnity product, and a little bit of how to and what else is what other ideas we can include with that. I'm going to turn it back to Sadie right now, and if there are any questions, I'd love to take them as best as I can. And if I don't have the answers, we'll be sure to follow up, and if we need to make any corrections, we'll follow up as well with Sadie to make sure it's all communicated out to you guys.
Awesome. Thank you so much, Andy. If you have any questions, now's the time. Please put them in that questionnaire box. Andy, I have to say, I'm very impressed and very excited about this product. You know, it might feel like something to some people that, you know, these situations don't come up that often, but like you said, over 1 million, that's a staggering number of people that miss their enrollment. And I sit in the agent resources, our agent resources team, our support team, our work group chat, and these scenarios come up for people who fall through the cracks like way more often than what you might think. And even that example of the family that immigrated here, or, you know, they haven't had enough time to go on Medicare or anything like that. We've seen that scenario several times in the past several months. So that's something that happens. These situations happen, and it's kind of heartbreaking whenever you can't take care, you know, you have to turn away and say, sorry, there's nothing we can do. So this is a product that I really love. I even put in that group chat, I was like, during it, I was like, you guys are gonna love this product. This is so cool. So I'm really excited about it. And yeah, so let's see, we do have a question here. If you have any questions, please put them in that questionnaire box. Cindy's asking for clarification. Did you say a 90-day wait for an office visit, and is it the same for preventative care?
It's a 90-day wait just for preventive care. So an office visit can be within the 90 days.
Perfect. Okay. Let's see. If someone moves to a non-coverage state, can they carry the plan with them?
I believe there are portability measures in this, but I'll confirm.
Perfect. I have a 78-year-old woman who came off a student insurance plan and is not Medicare eligible. How long could she keep this plan?
I have to go back to the slide to understand the. Let me see if I can't get back to the eligibility on this. Bear with me here. So I know it goes to age 85 on the. There we go. So it has to be age 74 at the time of application. That was what I wanted to confirm. But you can. But if they're age 74 at the time of application, it can be renewed until age 85.
Perfect. And there is a follow-up comment to that. He said she's not a U.S. citizen, but she is married to a U.S. citizen. How does that affect her eligibility for this plan?
I don't believe we require a social on these type plans. And that's typical of these products on the under 65 side as we have them. We've been selling this type of product on the under 65 side for many years. So typically there's no SSN required, but I will confirm that as well.
Awesome. Yeah, that's a good question. I do have one question about this that that people from internally here at SMS thought that maybe we would want some clarification on. Could we get some clarification on the association membership in the states that require it?
Yeah, that's a great point, and I left that off here and probably should have included it. But as you look at the association piece, the association piece is tied to member benefits, and the association is how we file our product in a lot of states, just because of commonalities in the filing process, and it makes it easier to file. But you'll see association plans, and especially on the under 65 side, on the indemnity side, or supplemental, or short-term medical. And the association typically comes with like a fee, right? And but a lot of times with those fees, you don't get anything for it. Whereas we include member benefits, and the life association piece on the senior indemnity, I believe, includes telemedicine, has discounts for like for prescriptions, diabetic supplies, but there's also consumer discounts that apply as well, like identity theft or restaurants or travel discounts. I have one agent that how he sells it is that it's, for they utilize it to get tire discounts. It's like a 15% discount on tires. So if, you have $700 set of tires, you get a 10-15% discount. That's a pretty significant savings. So, but where we typically will see the value of this come from is on the telemedicine front. And because a lot of times you'll see telemedicine that telemedicine is going to be A, you pay a premium for it, but B, a lot of times you pay like a $40 copay for it, or $35 or $40 copay. And traditionally with this product, you're not going to require a copay at all. So there's no extra cost to the client to utilize that telemedicine. Now here's where Missouri differs, and why I left it off is because the telemedicine piece, and I'll have to confirm, but the telemedicine is a component that, or excuse me, the Missouri is trying to find the words here. Missouri is a individual file state. So it's not an association state. So states where you don't see the life association, it's because it's an individual file. For example, on our short-term medical, the association is optional. We include it as an option to add on. But in Missouri, you'll see, if we go back to the slide that has the quoting piece to it. Pardon me for jumping around here, folks. So you'll see here in the shopping cart, you can't really see it underneath here, but at the bottom, underneath senior indemnity, underneath this, there'll be a spot for the My Life senior My Life wellness, and you'll see it right here, or My Life Senior Plus, under the recommended solutions. That's available as a standalone and an add-on. It is commissionable. So from that standpoint, in Missouri, it would be an add-on, but in other markets, say like for example, you go to Texas. Texas is going to be automatically included. So because we file as an association in Texas, but Missouri is an individual file, so therefore the association is not part of the filing, and we just simply put it as an add-on. So be sure to, if you want those benefits included within there, then be sure to include the My Life Senior Plus, and that will include some of those additional benefits, such as the telemedicine.
Awesome. Okay. And that's, correct me if I'm wrong, but that's just a one-time fee, right? It's not like a monthly or anything like that.
It's a monthly. It is monthly.
Okay.
Yep. Yep.
Awesome. Okay,
Yep.
great. Let's see. Okay, it doesn't look like we have any more questions, but I'm going to give you just one more minute. Don't want to hold anybody on here for too long. Andy, I do have just one last question for you, and I love to ask this question, and I'm excited to ask you about this one. What is your favorite part about this plan? What excites you the most as someone who sees this and is presenting it?
Yeah, I like the fact that it serves a market that when we talk to agents, and I maybe said this earlier, I like the fact that it serves a need that agents can cover, right? So when an agent says to me, I didn't have anything for them, or I wish I would have known about this, I had a client, this serves that need. It's additive to what you do. It's going to fill a need that a lot of agents that have expressed to us, we didn't have anything for this type of client. So I believe that this product is going to help agents fill that void of having to say, I don't have anything for you at this point. Does it come a little fewer and far between than maybe like a Medicare supplement or a Med Advantage? Probably, but at the end of the day, it's that type of product that's going to be able to make an agent look like a hero for those that are locked out of that particular moment in time.
Absolutely, yes. Here at Senior Marketing Specialist, one thing that I say, and basically every training I do, is that you can be an insurance agent, you can be an agent, or you can take it a step farther and be an advisor. You're able to fill in those holes, you're going above and beyond. And this is one of those products that if you have this on hand and you have it in your portfolio and you're able to help those people that are unhelpable, that's just one extra thing that helps make you an advisor, that takes you a step beyond being someone's agent. So yes, I absolutely love it. I love, I love this. I'm glad that
we're problem solvers, right? We're modern day problem solvers, and that's our role. And if we can't solve a problem, then that weighs on us, right? That's because our role is to help find the right products and solutions and help solve problems that our clients have. And if this is one that there's a void in the market, then we're happy to fill it.
Yes, absolutely. I love it. Awesome. Well, it doesn't look like we have any more questions, so we'll go ahead and wrap this up. Andy, thank you so much for joining us today. It's a pleasure as always, and we'll talk after this, get some resources and send that follow-up email out. But yes, thank you, Andy, and thank you everyone for joining us today.
Thank you all as well. Appreciate it. Have a great day. Stay warm.
Yes. Bye-bye.
Bye.